Hi, this is Kyle Wallace with the Wallace Specialty Risk Strategies Dental Practice Insurance Program. We talked last time about the problems in health insurance and the delivery of health insurance benefits. Today, we're going to talk more about cost containment with health insurance and the costs associated with medical care. Today, again, is my guest, Doug Sherman, co-founder of Clearwater Benefits. So, Doug, we identified a lot of problems in our last discussion with the health insurance benefits delivery system, but I take it all is not lost.
No, it's not.
How do we contain costs with the delivery of medical care?
I think some of the background, Kyle, would be really helpful to realize when we look at the major carriers, if we understand the economic model, we can then see how we can save money. With the major carriers, according to the Affordable Care Act, they are limited to 20% of the premium each year. It's capped. The amount that they get for fees and profit is capped at 20%. And at first I thought that was a really good idea. And then I realized that actually incents them to have premiums go up. The more the premiums go up, the more that they make. And so there are other plans that don't have profit. And we can start by just removing that layer of profit in them and just have fees rather than profit. That'll save 10 to 15%. We just do that. But the really big cost containment issues have to do with the relationship between the insurer and the provider, between the insurance company and the hospital, let's say. So hospitals typically send out a bill for their surgery, and it doesn't get looked at by the insurance company for 6 months typically, and then it goes through a due diligence period, and they get paid, let's say, a year after the surgery.
Wow.
So my wife had a emergency appendectomy not long ago. It was $125,000. They send the bill to the insurance company, and then a year later they get their $125,000, or they may disagree with the diagnostic or something like that. If we go in and say, either before, and they can't do this in an emergency, but say for an elective surgery like a gallbladder surgery, we go in ahead of time. We say, we'll write a check to you today. We can get sometimes 60, 70, even more percent discount because it advantages them in their cash cycle. Now, the major carriers can't do that because they've got network contracts that were built long ago, and actually they're not incented to try and reduce that amount because the more the claims, the more they can charge the following year in premiums. So the first thing we do is we put them on a plan that doesn't have a profit to it. It has fees, but it has no profit. And the second thing we do is we negotiate claims either before or after. The third thing we do is that the whole drug plan that's part of our health insurance can come from a number of different sources. Those sources can have kickbacks, overrides, bonuses to various players up and down the supply chain, or it could have no kickbacks. We use what's called a pharmacy benefit manager that has no kickbacks. Well, 20% of the cost of health insurance is drugs today, and it's increasing.
Oh, okay.
So if we could save 20, 30, 40%, we have significant savings. But the main cost-saving element of health insurance comes when you can negotiate the most expensive part of healthcare, which is surgeries and expensive procedures. If we can get those down 60, 70%, imagine what that means for the premium.
Why would doctors and hospitals be willing to negotiate? I mean, what are they getting out of it?
Well, the advantage is if they can have X dollars now versus 2X dollars in a year, it actually helps their business. And it's kind of a common cash management issue for all businesses. The earlier you can get cash in the door, the better. So they're willing to discount when they do that. Also, they're actually set up to have those discounts. It's not widely known, but they actually incent people to do it. It's not just that they're willing to do it. They want people to do it because they want that cash.
Tell me, if you can do this, if Clearwater can do this, can't the traditional health insurance companies, the great big 900-pound gorillas, do this?
Good question. What they can and can't do is not entirely clear to me, but here's what I do know.
Yeah.
It's not in their interest. It would go against their business model. If they were to do that, then their profit would decrease. These are public companies.
Right.
Imagine explaining to Wall Street why you're going to make a move that's going to fundamentally decrease the earnings before interest and taxes by 30%. It's just, it can't happen. The business model won't let it happen. The other reason, and it's an issue, is they have contracts for how much they're going to pay.
Okay.
And in the state of Texas, for example, the average bill is 6.6 times Medicare. So they have contracts with all of these providers, and one provider could be 10 times Medicare, another 4 times, but the average is 6.6 times Medicare. When we negotiate up front or immediately after, we stay around 2 times Medicare. Just to give you an idea of the dimension, and we're talking about the most expensive part of health insurance.
Wow. Well, it sounds to me like there's a lot of fat in the system, and that you're putting the system on a diet a little bit.
It is, and the thing that we can do is we can then turn around with some of that savings and then give it to the member. So what we like is the zero deductible part of our plans, where if they call and they go through our care coordination, if they see a specialist and they have a surgery and then they have the recovery, that whole process will cost them $0. And we think that's just as important as reducing premiums, is getting the cost to the member down, so that if they're ever sent to get an MRI by a doctor, there's a problem or a potential problem.
Right.
We want them to get that, and we want to get that early, and we want their outcomes to be better. And we know if we make it affordable, we're going to save money on the plan. So let's give some of that savings to the member and not make them pay anything out of pocket.
That's excellent. Sounds like maybe 10 years in, we might be getting to affordable health care.
I hope so.
Thank you for joining me today, Doug.
Thanks, Kyle.
And thanks to all of you for joining us in our discussion. If you want more information about the Wallace Specialty Risk Strategies Dental Practice Clearwater Benefits Health Insurance Program, please reach out to us by email at rdphealth@risk-strategies.com or call us at 972-346-0813. Thank you.